is next.
Thank you, Mr. Chairman. Thank you to the witnesses for being here. Dr. Huntsberger, thank you for being here as well. I had a question for you. As you know, thousands of women are coming to Colorado from out of state to get reproductive care. And in the immediate aftermath of Dobbs, the Dobbs decision, wait times in Colorado clinics increased from a few days to several weeks. Providers all across the state have scaled up their operations to meet this need, and none of the providers that I know are complaining about the fact that they're having to do that. But because laws in other states continue to change, the need constantly evolves in Colorado. And this comes at a big cost, I think, to patients and to providers. I wonder if you could talk a little bit about how the influx of out-of-state patients hampers access to reproductive care in a state like mine and pregnancy care for in-state patients.
I think you make an important point that not just the restricted states are impacted by these bans. I have actually specifically talked with friends who are practicing medicine in Colorado about precisely what you describe, the massive influx of patients seeking abortion care because it isn't safe or legal to do so in their own home state. That then impacts those doctors' ability to provide other care, to including routine prenatal care, preventative care like pap smear screening and birth control prescribing to people who are from Colorado. So I think sometimes we forget how intertwined healthcare is, and when we have such strict laws affecting one aspect of healthcare, that then translates to negative consequences for other unrelated aspects of care.
Could you talk a little bit also about what that increased burden has on the mental health care of providers that are now having to contend with this influx that's created because other states have decided to change their laws?
I think it's really challenging. You know, one of the things that we have seen in Idaho is patients being airlifted out by helicopter to other states in order to have access to safe, health and life-saving abortion care. Can you imagine being on the receiving end of that? A patient who previously could have been stabilized in their home state, then coming to you, the time that it takes to load a patient up in one hospital, to get them on a helicopter, travel somewhere else, then get unloaded from the helicopter so that their healthcare emergency can be addressed. This, again, has not just impact on healthcare teams in Idaho, but also the places that are receiving these patients who are sicker than they were before they left their home state.
One of the things, Mr. Chairman, that I just found so unbelievable when I read the Alito decision in the Dobbs case was there was no discussion at all about what the practical effects would be on women today. His view was, and you can look it up and read it, his view was if it's not a right or a freedom in 1868, it shouldn't be a right or a freedom today. None of these practical implications were considered at all. And when President Trump goes around the country and says everybody wanted Roe versus Wade reversed, that everybody, he says all Democrats wanted it reversed, that the law professors all over America wanted it reversed. I mean, it's patently false. It's not true. And he thinks he's making, I think, a compelling states' rights argument. And it ignores, first of all, the fact that what we're talking about here, in my view, not that no one has to share this view, but a fundamental civil right, a fundamental American freedom, the first one that we have lost in this country since Reconstruction. But even if you don't agree with that, the practical implications of not having this decided at the national level and, quote unquote, leaving it to the states, as Donald Trump daily, on a daily basis, suggests the majority of Americans, not even the majority, a universal view of Americans, is that he was right to do it, utterly ignores the reality of what people are having to deal with. Most importantly, women that are having to come to grips with this all over the country, doctors in my state and other states that are having to come to grips with this. And it's not surprising to me that there are states all over the country that are changing their laws, but the damage that's going to be done and inflicted in the meantime is damage that we should never have had to suffer. Doctor, I appreciate very much your testimony. And Mr. Chairman, thank you again for holding this hearing.
I thank my colleague for his important remarks, and I think Ms. Joshua is an actual example of what Senator Bennet described. The chaos and the discord led to the problems, in my view, that Ms. Joshua had, and we'll talk about it some more. Next is Senator Dane.